Welcome to PoliticsNY with Skye Behind the Curtain. This is the Healthcare Power Leader edition, where I am joined by Dr. Ken Davis, the CEO of Mount Sinai Health System. So Ken, tell us, academic accomplishments aside, how does one become the CEO of a hospital system? What's your story?
Well, in my case, it was utterly accidental. My goal in life, from the time I could conceptualize what I wanted to be, was a scientist. When I was a kid, I played with a chemistry set and I blew up rockets. Well, I spent a lot of sports too. But I wanted to be a scientist. And I was fascinated with brain disease. I don't know why. I just couldn't understand how some people could see things that weren't there, hear things that weren't real, believe things that were completely bizarre. So I got very involved in brain science. And I became a research psychiatrist. Had a lot of grants, wrote a lot of papers, had a lot to do with all the drugs that are approved currently for Alzheimer's disease. Worked a lot in schizophrenia. Anyway, having been the chair of psychiatry for Mount Sinai for a long time, the deanship became available. And I thought, well, that would be a nice thing because I could continue to do my research and be the dean because it's still an academic job. And I was the dean for about 10 weeks when the chairman of the board called me into his office and he said, we're firing the CEO. We want you to do both jobs. So, oh my goodness, this is for real. Anyway, I realized that would be the end of my scientific career, but I was deeply committed to Mount Sinai. I thought it over and I decided to do it, despite the fact that I just received a huge grant to study a very important new pathology that we discovered in schizophrenia. Handed that to a colleague and they took over. Mm-hmm. So I became the accidental CEO. And part of the reason they fired that CEO was because we were having tremendous financial problems. And they thought that the place might not survive. So my job was to save Mount Sinai then.
And you did it.
We did, with a lot of help from a really good management team.
Yeah, that's what it takes. It's the science and the business. You have to have a business mind too. So back to healthcare, really, the pandemic highlighted the disparity in healthcare across New York City. And I'm wondering, what can we do about that to help people in need and make sure we don't have those disparities moving forward?
This is a critical question. And it's something that we've been targeting for a very long time without success. Where does it start? It partially starts because in the Mount Sinai system, as an example, Medicaid underpays what the real costs are by 35 cents on the dollar. Medicare underpays by 15 cents on the dollar. So if you don't have commercial insurance to make up for it, you're in a lot of trouble. And that's why a lot of safety net hospitals in socioeconomically deprived areas are in such difficult times. And those hospitals are in such serious jeopardy. But the outcomes are all so bad because of the social determinants of healthcare that we as providers can't change. Let me give you an example. If in the public housing, we don't change our air filters regularly, those people with lung disease are going to suffer. Mm-hmm. But we don't think about that. If people can't afford quality food and they don't have time to cook and they buy a lot of prepared stuff with high fats and high salt because it tastes good and it may be inexpensive, that's not going to increase their likelihood of living a long time and having good outcomes. Because when you come to our hospital with comorbidities like diabetes, which is a consequence of a lot of obesity, or some cardiac disease because you have not been taking care of your diet, or you don't have the time to exercise, then you get bad outcomes. Those are social determinants. So what we need those who are in public policy and those who make decisions to realize is that unless we attack those social determinants, we won't have healthcare equity in outcomes.
I know. So that's my next question is politics has a lot to do with this. You mentioned NYCHA and changing air filters, and it comes back to government. And even during the pandemic, we turned to our government leaders to find out what was going on and what the rules and regulations were. So how can you work with elected officials to make these changes happen?
Well, we try to meet with elected officials as much as we can. We work through the Greater New York Hospital Association, with Haney's, with other groups that sit down with our leaders and try to educate them. But, they live in a different universe than us sometimes. Their concerns are, how do you meet budget deficits or budget requirements? There are other concerns and values that they may have, or just, naivete about what healthcare is about. So we have to sit with them, we have to educate them, and we have to do it in a way that is not partisan, that just is factual and data driven, and then hope that they can help find solutions.
Mhm.
You might have read this, but a very interesting thing that's just come out in the infrastructure bill is that Chuck Schumer wants to use some of that money to change the way the Cross Bronx Expressway pollutes the South Bronx. I mean, that's important. That's something we can't deal with, but politicians can. And perhaps with the right kind of coverage and vegetation, they can save some of the illness that goes on in the Bronx because of this road that Robert Moses put right across the Bronx that has the consequence today of detracting from healthcare.
Right. It has to be an open conversation with healthcare leaders and elected officials.
Absolutely.
So what other career advice or just healthcare advice do you have for people in general, industry advice moving forward?
Well, we have tremendous challenges and tremendous opportunities. We are living now through the revolution in biology, a revolution that can change humanity. A previous generation lived through the revolution in physics, and the revolution in physics gave us nuclear power and nuclear warheads. It also gave us rockets that could go to the moon. Well, who would have thought it? Quantum mechanics, who would have thought it? Well, my grandchildren, hopefully 50 years from now, is going to say, can you believe they really died of cancer? Can you believe those diseases? They really had those back then? Well, we have the capacity to change mankind forevermore if we make the investments in the revolution in biology that are in front of us.
Sounds really inspiring.
It's possible. It's possible. When we look at the human genome and we understand the basis of so many diseases and we have so many new drug targets, the question is, how do we mobilize ourselves to take advantage of the revolution in biology and change the course of humanity? It might very well be that they'll say things like, can you believe they only lived until maybe 70, 80, and if they were lucky, they might have got into the 90s? I mean, we're going to live to 150.
Wow.
There is a biology to aging. I mean, why is my dog going to likely die at 14? Why is some Drosophila going to live a couple of days? We're going to live 70, 80. Galapagos turtles are going to live over 100. There's a biology to this. We're going to understand that biology and maybe change it. This is what we have to look forward to. But it takes people with vision to be able to invest in that.
Beautiful. And let's end on that note. Dr. Ken Davis from Mount Sinai Health System, thank you so much for your time and congratulations on being named one of the Schneps Media's Power 100 Healthcare Leaders.